Stimulus checks are here, everybody, and get ready to receive them. So we have a ton of good news about the fourth stimulus payments. There are huge developments being made on the fourth stimulus package. The IRS has confirmed a possible new delivery date for the next round of stimulus. So with tax filing season already underway, many tax experts are warning taxpayers to brace for another year of delays and complications. Underscoring the importance of filing early and preparing your information, the IRS started accepting 2021 tax returns on January 24th, more than 2 weeks earlier than the start of last year's filing date. Most taxpayers have until April 18th to file, but the IRS has a long road ahead of it. Stimulus checks and scaled up child tax credit payments are creating extra work for the IRS. So, in many areas, the IRS is unable to deliver the amount of service and enforcement that the tax system needs. So folks, in 2022, the new year of this year's tax filing season all comes down to the crisis. The federal government tasked the IRS with delivering most of the direct aid approved for 2021 in President Biden's American Rescue Plan. According to the IRS commissioner, they said they urge extra attention to those who received an economic impact payment or an advanced child tax credit last year. And people should make sure that they report the correct amount on their tax return to avoid delays. Plus, those features can cause delays because they leave more room in error, either because the IRS didn't tally American stimulus totals correctly or because taxpayers made a math error. So when a tax return doesn't match up with IRS records, it's placed at the agency's paper processing backlog, a logjam that's been increasingly harder to work through amid hiring and training challenges. That means taxpayers are likely to encounter delays if they make a mistake when they file, or even if they submit in a return that's an error-free return. Taxpayers who also wait up until the last minute risk accumulating a significant wait time. According to tax experts, getting started early and filing electronically are the two most important things when you're trying to get a stimulus check and extra money from the IRS. And if you are a U.S. household with dependent children, you will also want to pay careful attention when submitting your tax return this season, because it's your main opportunity to reconcile any missing child tax credit payments or settle any overpaid balances from throughout the year. Friends, keep an eye out for letter 6419 from the IRS, which will detail how much money you've already received through the program. The maximum credit a household can receive per each child under age 5 totaled around $3,600, while the maximum payment was around $3,000. Now, before the credit was $2,000 for all dependents. Now, unless families opted out, most households have likely received half of the credit that they're eligible for via 6-monthly advance payments. That means they can expect to receive the remaining balance of up to $1,800 or even $1,500 on their 2021 tax return. Also, on the flip side, taxpayers who opted out of the advance payments will be able to claim the full credit on their 2021 tax return, a sizable return compared to the original amount of $2,000. And the good news, everybody, is that many low-income Americans can expect to receive a bigger child tax credit than they're used to because the credit was made fully refundable. Unlike stimulus checks, the IRS will require taxpayers to reconcile any overpayments.
You're entirely welcome. Nice job for a BC graduate, law school graduate. But I would like to pursue this. I think we've done a lot of work with this in California, and I know other states, to try to help small businesses, particularly restaurants, of which I'm familiar, coming out of COVID. So with that, we will now recognize Congresswoman from Washington, Congressman Jayapal. Welcome to our subcommittee.
Thank you so much, Mr. Chairman, and thank you for allowing me to participate in this incredibly important hearing. So many important points that have been made, and I share Representative Banks' concern about hospital consolidation, increasing healthcare costs, and Mr. Blaze's suggestion that the FTC be able to scrutinize mergers among nonprofits is actually exactly what my forthcoming bill would do, something I think will have tremendous bipartisan support. Let me also put an emphasis on Secretary Reich's comment that it would be hard to invent a more complicated and expensive healthcare system than what we currently have, and one that produces some of the worst health outcomes compared to other peer countries in spite of what we spend. During COVID-19, an estimated 27 million people lost their health insurance due to job loss, a perverse tie-in that put a double whammy on working people. Medicare for All would have prevented that and would have ensured that all workers have the health care they need from birth to death, regardless of employment status or socioeconomic status or race, ethnicity, gender, or any other classification that is now used to deny people health care. The committee has a chart that I want to share. And so Banyan, if you could put that up, thank you so much. This chart is from the Institute of Medicine, and it shows the ranking of US mortality by age group among peer countries. The United States has the highest mortality rate for all ages up to 65 when we rise to the top of the rankings, with one of the lowest mortality rates. It is no coincidence that this happens as soon as Medicare coverage begins. So Dr. Benjamin, as one of the nation's leading voices on public health issues, can you explain how having stable universal health coverage, such as Medicare, improves health outcomes?
Yeah, coverage matters. The fact that you actually get the care that you need when you need it makes a big difference. The number of times that people do an insurance card biopsy when you first show up to the healthcare center, ask you what your insurance plan is, and it drives a whole lot of things. And quite frankly, the cheapest way to reduce healthcare costs for everybody is to make sure that everybody's covered.
Thank you so much, Dr. Benjamin. Dr. Reich, a couple of questions for you. I want to talk about this tie-in between healthcare and insurance. What harms does a system that tethers health insurance to employment, even with the presence of a public option, present? That's the first question. And then secondly, researchers at the Economic Policy Institute, which you co-founded, found that Medicare for All would increase wages and salaries for workers. Right now, labor unions struggle to bargain for increased wages, while they also have to bargain for adequate health insurance. Can you talk about the effect that Medicare for All would have on labor union bargaining and those wages and benefits that are bargained?
Yes. First of all, Congresswoman, by tying medical insurance to employment, as we now do, we find ourselves, more and more people are tied to their employment. At a time when not only have we been through a pandemic and we've seen how fragile that employment relationship can be, but also we have more and more people who are working part-time, who are contract workers, who are self-employed. We have probably the largest portion of our workforce in terms of growth right now are people who are not tied to individual employers. They really get shut out of a healthcare system that is employer-based. And we need, if you're just looking at trend lines, we need to make sure that they have portable health insurance. Labor unions, you ask, well, labor unions have limited bargaining power, obviously. What they are now doing is using part of that limited bargaining power